because we are experiencing a pretty dramatic increase in mental health concerns in our student population. Actually, that's also mirrored among our faculty and staff as well. The World Health Organization put out an article that looked at students entering higher education in 19 different universities across 8 different countries. And they were seeing that 35% of those students were screening positive for one of 6 prominent mental health disorders. So over 1/3. And so it's not just a local issue where we're seeing counselors not being able to keep up with demand for mental health supports on campus in terms of direct services. We're seeing this as a global challenge. And so we have to get way more thoughtful. We know we're not going to be able to meet the resources and demands of direct service models where we can't just continue to throw more counselors and mental health professionals at higher ed institutions. We just won't fill the gap. As a response to the mental health concerns, we as institutions need to focus on resilience and compassion as a way to create more upstream interventions that kind of take some of the pressure away from our direct service models of supporting students, especially around mental health and well-being. Knowing that capacity and costs are getting so overtaxed there, we want to make sure that students who absolutely need to see a counselor have access. And part of creating that access that, we're hearing wait times across not just our institution, but across the country for students to access mental health professionals is increasing dramatically, and the drive and need for mental health professionals is increasing. So the more upstream interventions through courses, through programming, through integration of themes across programs is a way to actually kind of shift the narrative and support students across the board. And I mentioned that this isn't just about students. I think one major issue we see is that institutions try to just program at students, especially around mental health and well-being. If faculty and staff are not embodying the work and doing the work themselves, students won't pay attention to the messaging. So overall, this has to be a community-wide kind of global approach to well-being and compassion on campuses if we actually want to move the dial and create a different type of institution. So we have people having different experiences of well-being on our campuses. To that end, that this isn't just a student issue, this is a student, faculty, staff, community issue. It would be hard for me to give you a job title that wouldn't be impacted by this. This is our counselors, this is our academic advisors. We do a tremendous amount of work with faculty to support our faculty in thinking about embedding well-being into their curricular spaces. This is kind of soup to nuts everyone. This is our deans and vice provosts. This is our institutional president, having to kind of think about and respond to this work in real time.